And we have breaking news out of Florida. A federal judge has voided the federal mask mandate for public transportation. Monday's decision found the CDC failed to justify the requirement and did not follow proper rulemaking procedures. The ruling comes only 5 days after the CDC extended the mask mandate for planes, trains, buses, and transit hubs to May 3rd. The Justice Department has not yet commented on the court's decision. Joining me now is CBS News transportation correspondent Errol Barnett. Hi, Errol. So what is the reaction to this news, and do we know when it will take effect in Florida?
Hey there, Tanya. Great to you. Well, there have been a number of legal challenges against the mask mandate over the past years. And if we're just gauging by the lack of available and fast response by many of the government agencies responsible for implementing this mask rule, it does appear that this federal judge's decision today in Florida came as a surprise. I mean, we've reached out to the Department of Transportation, the Department of Justice, the CDC, the TSA, and none of them are commenting on the record just yet. They prepare responses to this. This specific challenge was brought by a group known as the Health Freedom Defense Fund, and their claim, among other things, was that the CDC its bounds in putting this vast, wide-reaching mandate in place. And so I'll just read to you some of the decision by Judge Catherine Kimball Mazzell. She wrote that, quote, "The court concludes the mask mandate exceeds the CDC statutory authority and violates the procedures for agency under the APA, that's the Administrative Procedure Act, and accordingly, the court vacates the mandate and remands it to the CDC." Those very last few are key in saying that while the judge has decided the CDC overstepped its authority, it is vacating that rule and pushing it back to the CDC. So we really do want to hear now from the Centers for Disease Control on what its decision, what its legal response will be, and what we should all do in the meantime. Absent of any clarification, Tanya, this mask mandate continues to be in effect, but as you just mentioned, it only has less than 2 weeks to go. So it's a real inflection point. It has long controversial aspect of the government's COVID response.
And so, Errol, do we know how popular a federal mask mandate in transportation settings is among Americans? Because obviously there are some people who are bothered by it, but there are other people who say, you know, I'm not going to travel unless people are wearing masks. So do we know where that breaks down?
Well, you make a great point. It depends on who you ask. There was a recent study which found that more than 10% or roughly of Americans support an extension of the mask mandate. That survey was done late March, early April, just as the BA2 subvariant was spreading. But when you talk to industry leaders, airline executives, they are pushing against this mask mandate for quite some time. They want it repealed yesterday. They argue we have vaccines. We have other mitigating factors. And yes, the irritation that is wearing a mask for many hours on a, let's say, international flight, they say has deterred a lot of Americans from traveling, not just across the US, but internationally as well. Let's not forget how flight attendants feel about this. They've been the subject of so much frustration as they try to disputes and unruly passenger aircrafts. Sure. Most of those incidents were based on the mask mandate. They are now calling for calm and consistency as this rule remains in place before we get clarification from the Department of Justice.
Sure. And so, Errol, another piece of news that does involve the CDC today and travel is that the agency updated its risk assessment criteria for traveling Americans, moving 89 countries off of the do not fly list. That level 4 category will now be determined by special circumstances as opposed to incidents or case count. Can you tell us what the significance is of this change?
Well, Tanya, this actually shows us what's happening as far as what the CDC is thinking and how it sees the global picture when it comes to fighting COVID. It obviously appears to them that the global condition is improving. And so a lot of these warnings and barriers to travel are slowly coming down. And let's not forget that the reason the CDC extended the mask mandate for only 2 weeks, not another 1 or 2 months, was so that they could reassess subvariant impacting hospitalizations and deaths here in the United States. Dr. Ashish Jha, that's the White House COVID coordinator, has said much that these 2 weeks really give it time to assess the data so that when they do repeal the mask mandate. They can say the reasoning isn't political, has nothing to do with legal challenges, but is based on the science. And so the fact that the CDC is the global for travel tells you that we are moving in a direction where getting rid of the mask mandate rather than later.
It could be next. All right. Well, Errol Barnett, thank you so much. We appreciate it.